Welcome back. Well, with us right now is doctor who's been with us before. It's good to see you again, Dr. Mercedes Tomioka, and she is practices internal and geriatric medicine with the Hoag Medical Group here in Irvine. Welcome back.
Thank you very much, Ken, and good to see you again.
You're going to talk about something that's going to be very uplifting here. What's normal and what's not when we age.
Yeah.
And I think it's a real important topic because, you know, as we all age, we kind of wonder, gee, I twisted my knee a little bit here. It's now taking me 3 weeks to heal up, where 10 years ago it would heal up in a week. Is that normal? And you begin to worry about it because you want to know, is there something more wrong here or is there not? So we're going to talk about that, what kind of changes we expect with aging, what is normal, what isn't, and I think it's a great topic.
Yeah, sure. The thing is that our organs age in a different rate, and this is based on genetic composition. So, for example, some of us may have gray hair earlier, or baldness, or the skin, may turn more wrinkled, and the same like height. We may shrunk. Because there are some diseases that may cause that. The same for hearing, vision, insomnia. It's a very common complaint at this age, and sometimes could be related to underlying medical conditions that need to be taken care. There is other things that we are more prone to develop, like high blood pressure and diabetes, and our muscle also turns more atrophy and turns into fat tissue. And memory, it's another thing that we are going to talk about as well.
So, the underlying thing is we all age, things start to wear out and break down a little bit. It just, again, depending on your genetic makeup, you may not see this until you're 70 or 80. Other people might see this when they're 50.
Right.
It just depends.
Right, exactly. And the thing is that it's very important that you go to your physician to recognize, what is normal from what is something that you should be concerned of.
Right.
No? So, for example, in the skin, we have different skin lesions. We have something really benign called seborrheic keratosis, which are some brownish discoloration. Most of them are cosmetic. It can be removed easily. But the other ones, like actinic keratosis, those are pre-malignant lesions.
Okay.
And that needs to be taken care of seriously, because otherwise you can develop skin cancer. The other thing very important on the skin is shingles. It's very common to get shingles at this age because and the virus is the same like the chicken pox.
Yes.
There are vaccines that we can prevent this. It's not guaranteed that you won't get it, but at least you will get a mild symptoms of the disease.
Yeah, and this is something that I had myself about a year ago. It was 2 years ago, actually. It was, unfortunately, I had a very, very mild on my side, even to the point that I wasn't sure. I kind of knew it, but I went to the doctor and they gave me whatever it was and it was gone. On the other hand, last May, my dad was visiting, and after about 3 days, we had a little bit of a headache, and really he felt like there was kind of pressure behind his eye. Well, he gets home, and within a day, he finds out it's shingles. Here it is in October. He still has symptoms of it. It has not gone away since May. It'll come and go, but he has not been without it now for 6 months. So we know how, depending on your age, and it can be quite devastating.
Right, and the most important thing for shingles will be just to get checked within the first 3 days of the symptoms.
Yeah.
So that then the complications like the pain and things like that doesn't persist.
We seem to hear about shingles more today than we did 10 years ago. Is that simply because we're seeing the advertisements for the vaccine, or has it become you're detecting it quicker now, or is it
I think we are
there?
diagnosing more right now and earlier, and we have the better treatment right now and better knowledge about how to manage these conditions.
But it's always been there. People have had chickenpox.
Yeah. Always been there. Yeah.
All right. Also, the other changes, as you mentioned, I think things we know obviously is
Right.
vision and hearing,
Vision and
because it's
hearing.
right there. You know your vision. You get 40 years old, you got to put on those reading glasses.
Exactly. And that condition is called presbyopia. So basically, it's because the lens gets a little bit thicker, less elastic, and you may need to wear some reading glasses. But there are other conditions that are, things that needs to be taken care, like cataracts, glaucoma, and macular degeneration are the most worrisome because they impair your peripheral vision, glaucoma, or your central vision, macular degeneration. And actually, the patients who wear glasses from younger age, they are the ones that are detected faster because, as me, for example, we go every year to change our glasses. So I mean, they are always checking the pressure and the optic disc. Rather than patients who never wear glasses, they are not used to go to the optometrist. So if you go to the optometrist, sometimes they can detect these conditions.
Yeah, yeah. And of course, hearing.
Yeah.
So as we age, it's just inevitable. There's certain frequencies we're not going to hear anymore, even a 20-year-old versus a 30-year-old.
Exactly.
Yeah.
So 1/3 of the population above 60 is going to start declining on the hearing aid. And this is also genetic composition. So if you have family members that had that problem earlier, you most likely will have it. But the thing is, the most important thing are the red flags. So if you have fever, pain, discharge, things like that, or dizziness, or unstable gait, or vertigo, so those things need to be taken care of because it could be infections, it could be tumors, it could be a stroke. So very, very important to recognize that earlier, and go and get checked.
Okay, and your last slide here is about healthy brain checklist. Now, this might be a little bit hard to see on TV, so let's go over a little bit of this. And I like, it's basically a self-questionnaire.
Exactly.
Yeah.
So this questionnaire, you can find it at the ocvitalaging.org, and it's very simple. This question, so everybody forgets sometimes, where do you put the keys or what was the name of this person, that could be normal, memory problems from aging. The most likely reason that you forget is because you are distracted. But over the age, also the information processing slow down, and you the multitasking, skill that you had before may not be sharp like right now. So when you do this, self-screening test, there are only 3 questions. The first one is if you require assistance remembering appointments, family occasions, holidays, or taking medication. If the answer is yes, that means that most likely you have an underlying condition that is causing this, and you're required to be checked. The second one, classifies questions about symptoms of medical condition from symptoms of normal aging. If you just have the ones of normal aging, then that's okay.
Yeah.
The other ones will be, the worry ones that you need to go ahead and evaluate by your physician. And the third one, it's for depression. Depression is very common at this age as well. And sometimes if you have a severe depression, it can affect your cognition. Treating depression, it may reverse that memory problem that you have.
Yeah.
So.
Very good. I'm looking at some of these things.
Simple.
Completing complex tasks at home, balancing your checkbook. I could never do that. So I guess that's.
Yeah.
No, but I certainly understand how important this is. A great checklist. And where can they get this from?
ocvitalaging.org.
Okay, very good. Doctor, real good information. We appreciate it.
Thank
and
you.
It's good to see you again.
Thank you very much.
How's it going over there? You like Hoag Irvine?
Very good, very good. Enjoying every minute.
Great. Well, we'll see you again, I'm sure.
Thank you.
All right, we'll be back.
Okay.
What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.